I'm Heather Marie Schmidt and I'm a Senior Policy Analyst with the HIV and STI branch at the Ministry of Health. Contact tracing is one of the 5 key support services for the HIV Support Program. Contact tracing is the process of identifying contacts of patients who have been newly diagnosed with HIV and informing them of their exposure. This allows the contact to get tested, to know their HIV status, and if appropriate, to get the care and treatment that they need. A large number of HIV diagnoses are made by GPs who have never had an HIV diagnosis before. Many of these GPs have never managed a patient that has HIV. If you're the diagnosing clinician, it's your responsibility to initiate contact tracing for your patient. This may seem like a daunting conversation to have with your patient, but most patients will already be thinking about contact tracing before you've even asked the question. So you should try and start having that conversation immediately if you can. Contacts include people that your patient has had unprotected sex with or has shared injecting equipment with. It's important to start with the most recent contacts and work your way back to either the last known HIV test or the onset of the risk behaviour. So partners may be casual partners or they may be regular partners that they see every day. The highest priority is to find contacts who have been exposed within the previous 72 hours. These contacts can be offered post-exposure prophylaxis for HIV to lower their risk of acquisition. So your patient may have lots of contact details for their contacts. They may know their email address, their name and where they live, or they may have next to nothing. They may only have social media contact. However, all of this information is really valuable and can help identify who that contact is so that they can be notified of their exposure. Contact tracing is possible even with only social media details. Provide a referral where you or your delegate notify the contacts of your patient is preferred for HIV. However, some patients prefer to notify some of their contacts themselves, particularly for regular partners. If your patient would like to notify their contacts, then it's your responsibility to make sure that they have all of the information that they need to pass on to that contact. If your patient decides to notify one or more of their contacts, make a plan to follow up with your patient within an agreed time frame. Then you can offer them additional support if they need it, or you can offer to follow up that contact if they haven't had any success. There are a range of resources available to support you and your patient with contact tracing. Community support can provide a positive experience for people who are newly diagnosed with HIV and can help empower them to notify their contacts. New South Wales Health is developing a framework for contact tracing. The framework for contact tracing will provide the minimum standards, will provide guidance, will detail support and options for referral, and will provide templates to help you improve and record contact tracing within your practice.